Hey, B, want to address some things?
Yeah, it's time to address some things.
How about that?
Hello everyone, my name is Dinma, aka Dr. Dinma.
And I'm your girl, 2 shits in the air, bam bam. Feeling like, when will this pass? When will all of this come together? And I'll be like, yes, it was all worth it. Honestly, the vomiting, the pain, the nerve healing phase.
It's too much. I'm glad
It was a lot.
Jesus has my heart on my body.
Some days ago, or like about a week ago, I still felt like, what was I thinking? Because the pain, recovery, but right now I feel gorgeous.
No, girl.
Don't you think so?
Revelation. Okay. Excited. You're missing them already. Am I jealous?
Yes, be jealous.
Yes. Oh, she's not. She got the back. Smells like my small lady, like, but the truth is like this all the time. Definitely, we are less impressed when we really say, you know, the way we want it. Because, like I said, I'm going to follow your natural contour. I'm going to feel the hip dip slicing, maintaining your natural contour. We won't go above.
Not too much for my hair. I've seen some funny skinny
For
arms.
okay.
It's nothing so much.
Because I didn't have a difficult day yesterday, but
We thought the wrong was under.
it was. I'm sorry.
After you finish doing all this thing, they leave you with the nanny.
So you have a lot of videos of the kids, right? I have. So when you miss them, so who's with them anyway?
Oh, I have nannies. Then my cousin that's staying in go back for my brother is home. Teddy's home as well.
Okay, that's good.
And when she told me you're not staying, I was like, well, it's you I bonded with already. Oh, the lead surgeon being women. Oh yeah, that gave me some. I mean, Dr. Anyachibi is a consultant, Dr. D, and Dr. Dad, and everyone on the team. Fantastic. Just knowing that I was with professionals gave me a lot of peace. Yeah. Oh, not the tights.
My goodness.
My God.
How you feeling?
Very hard.
Early in the year, I had an underlying heart disorder per se. It's called Prince metal angina. when I was pregnant for Zen, I had preeclampsia. I had preeclampsia protein in my urine. And by the time I got to the hospital, my baby had detached from my placenta, my organs were shutting down. It was a scary experience. So I was on admission for about 7 days. Thank God for Dr. Yu, my gynecologist, who was very attentive to detail, and they were able to save what was left of all my internal organs. So that had triggered my heart being very sensitive, and when I overwork myself or overthink or I start getting too emotionally stressed, plus birth controls, I think they should ban birth controls, honestly. Because the hormonal ones, what they did to me, some people tolerate it better than most. So I went to my cardiologist, who had diagnosed me early in the year, to ask if my heart is better, because some of the anesthesia they use can follow the heart. So I needed clearance. I wanted to be sure it was okay. And just the waiting period was tense for me.
What non-medical preparations do you have to do before coming here today for the actual surgery?
I had to also to bath so that all the bacteria in my body can remove. I had to stop eating at midnight. I had my last supper. I had mashed potatoes with salmon and gravy, some vegetables. I took a lot of beetroot juice. Shout out to the food therapist. She made sure she stayed in my house and made me customized beetroot juice. So my blood will be pumping well and I'll have to do blood transfusion. I had to get a personal trainer a month before now so that I'm physically fit and I'm not too lazy and I can recover fast. Thankfully, I'm not one to use all those very harsh chemicals on my skin. Beauty oil for the win. I made sure that my skin is well moisturized so that the elasticity is elastic. That's about. Then I prayed a lot, committed myself to the Lord because it's elective. It's not like the trauma or emergency surgery. This is an elective surgery. But yeah, and then I made sure that I spoke with the consultant surgeon on duty to reassure me that all the risks have been looked into. I made sure I was on vitamins, a lot of them, vitamin C, B-co, blood tonic, so that's my immunity is on check.
But is there a time frame as to when to start this before the surgery?
Yeah, 2 weeks is usually the ideal time to start all of this. For lifestyle change, it should be a lifestyle thing. You should naturally be healthy. I stopped alcohol, even though I don't drink normally, but usually when I hang out with the boo, a few champagne glasses here and there.
Soda
has never been on my menu before. You know this now. No soda for me for a very long time. I've cut down on that a while ago.
Yeah. What was the last call with the hubby?
The last one?
Your last call with the hubby?
Call? I mean this morning.
Ooh, okay.
Yes, I'm gonna be on bed rest for a while. We need to make sure everything is serviced.
Okay, let's talk to Bambam post surgery, and I hear that you might be experiencing some emotional,
Okay.
So let's talk to Bami post surgery. What do you want Bami to be?
Bami, you decided to go along with this, so stop panicking. You'll be fine, honestly. God has said He's with you always, even until the end of time. You're not alone. It's called postpartum blues. Post-surgery blues. So I'm sure you like what you see in the mirror, don't you? You'll be fine, honey.
Or just stay here if we still want to discuss. Oh, yeah, pursuing me from the chair. The audacity. Are you serious?
That was smooth. What you just did.
So the man, they should be afraid.
She just made me elevate.
That was too smooth.
Like remote control. Like, there, please.
See, I'm gonna be your best VIP guest for the next 2 weeks. Then we use broom and brush me out.
Just told you. Just told you 2 weeks.
Absolutely unacceptable. 2 weeks. You will feed me, wash me, clean me, rub my body and my feet, and just, yeah, like you moldy.
You sure you haven't
come here so like I monitor to make sure that I'm not eating anything. Saliva. Yes, why you calling me a class actor?
But you are. I'm surprised you haven't heard that before. No? Really? Wow.
Thank you. That means so much to me.
My pleasure.
Introduce me well. Bami, the class actor.
I told my sister that I met her. She was like, oh, I follow her. I was like, she's really classy. She was like, I could tell from her videos.
Alright, madam, it's such an honor to have you as a lead surgeon in this case.
It's my pleasure.
What would you advise women, mothers who have had kids, women generally who have considered a liposuction or 360 lipo and BBL? What would you advise them? And they're scared because you know how much you needed to warm up my mind and make me see that it's not stigmatized. It's not, there is a perception to plastic surgery that we're trying to debunk here. So how would you talk to them as a woman and as a surgeon?
That's actually a very beautiful question you have just articulated. So I would first of all ask them to look deep within and find out the reason they want to have the surgery in the first place. It shouldn't be, the decision to have surgery shouldn't be guided by the pressures of society.
Yes.
You drown all the noise of social media and expectations of society and find out the reason why you want to do the surgery. And most of the time, when you do that, you will find that you're doing it for you to improve your self-esteem, to improve your quality of life. A lot of women had beautiful bodies before childbirth, and after having their babies, their body really went south, and they're still young women in their prime, and they want to be as confident in their clothes choices as they want. And then a lot of times it also improves their health as well for individuals who want to have their breasts reduced, for individuals who have a lot of abdominal weights that they're carrying. So it's also important to their health. So when you have drowned out all that background noise and determine for yourself that it is what you want, not what your partner wants, but what you want for yourself, then the next step is to research the facility where you want to have the surgery done, and also research your surgeon and ensure that it is a qualified person who is going to take on your case. And with all that, I'm sure that when you put all of these together, it would allay your fears, and then it will also give you more determination, because now you understand the true purpose of why you want to have the surgery in the first place.
See, like, I'm in the right place. Yo, I'm in love with this woman and all the team that I have to work with. God bless you. Thank you for your time.
Thank you so much.
What did you want to say?
I was like, you're just such a darling, you know.
Be patient. This is not rushing my production manager.
It's been a pleasure meeting you.
Thank you so much. And my brand. This is not how people used to do. Be patient.
Look at
What's happening? Oh my goodness.
We waited for, I said 3 to 5 months. Can you explain all these things that
we have talked, but I'm not, we're talking about your friend, herbal and dietary supplements, body piercing, nails, which after everything you said, you still want the nails to come.
there's a stigma that I needed to break mentally because of the perception of those who have done your body. And for me, I had researched and researched and researched and researched, and I was scared if it was worth it, to be honest. Then I met Dr. Dinma, who used her sweet tongue to enter my head. Try this woman. Don't even sit down with her. If you have fears, she is gonna convince you to the table.
I'll lay your fears. I mean, surgery has risks, but I'll answer your questions practically and you can see for yourself.
For a critic like myself, I literally started out as a medical student and ended up as a microbiologist. And I'm a germaphobe, right? She managed to make it look like a walk in the park. Boo! It ain't! It ain't! As you can see, it's serious.
Beautiful now. Then you go to hug him and if you do like this, you do.
I will pray for her.
Like, give me to drink.
Let there be love, share
No, see me here with you, baby. What do you mean? What you mean, girl? You got me. Deep believe now. Deep believe now.
It's the nod for me. They can't see you nodding. Speak.
Yes, I'll mute me.
Whatever the kisses we eat in front of her, no matter how she begs or how she does her face, you know, concern her.
How long is the surgery usually?
About 45 minutes. We can see if you try rice.
These are mashed potatoes and salmon and very good.
Also, calories.
Or quinoa with shrimps and filet fish. I don't do rice.
Yes, man. I hope your chef knows what they're doing. I hope your chef knows what they're doing. Because you know how much appetite you would have lost. None of these things. You just want water.
I can't wait for the few moments later in this video.
I see how we're about to show.
You must be appetite as well.
What this, the procedure, it will reduce appetite.
For a while.
Gradually start coming back. 3 days, 4. So she'll be doing half, yeah. Anything they bring, but you want to fix something.
Please swear to not be cranky or be giving straight face because you have a mean resting face. Oh my Jesus.
I'm sorry.
Okay.
Oh my
We're
God.
already saying it.
Alright, we'll handle
I'm
it.
just going to be looking at her. I'll just ask where is Dr. Dinma. Bring her to me now. Why?
Just ready for all of you. Emotional person.
How can you see that?
This
This is proper blackmail.
No, their muscles, their emotional muscles are strong enough to handle all that is going to come and unleash out.
Me, I'm just in awe. And yes, like you, I can't wait for the few moments later.
I can't.
Take me to my room. This is happening. Yes, it's real. My God. The black bed sheets. It's okay.
All business, I promise. I'm here, I'm praying. No, that's what it said. For staying. I know. Yeah, so it needs to be something. So welcome. Let me put this in.
How is this becoming?
My heart rate has...
I've seen your facial expression has changed.
No more looking around.
This is
Six bed.
okay, 6 bed.
6, yes. 2 in this room.
Yeah.
For me, it's like a baby monitor.
The CCTV.
Yeah.
So it helps secure your patient, right?
Yes, it helps me. I watch what happens. I watch what the nurses are doing. I check on the patient, and if I have to be here in person, I come down.
How often do you have like cases of, something went wrong?
Yeah.
How often does that happen?
Rarely ever. Rarely ever. You mean in terms of infections or generally surgery? Oh, but remember, surgery has risks, but rarely ever. We've had I would say 97%
Success rate.
yes. Yes, we've had that. Because each patient is peculiar to us. Each patient is a big deal. Each patient is special. We have to give her that time, or him that time and attention each time. Recently there was a rumor. What was that about? Right, so let's say there's been an elephant in the room and I am to address it. Most times there is the social media, I call it sensation, and then there is the truth. Every patient is peculiar. As expected of me, as a medical doctor, the focus was on the patient and recovery. It wasn't a time to come and, start saying a lot of things until we were sure the patient was fine, which is part of the ethos of our profession. The patient comes first. First, do no harm. A patient coming to you for care is like you feel that they are a part of you. You do not want anything to go on wrong with them. You want to be there for them to the end. So it was an unbelievable time because what was happening on ground and what was being portrayed on social media were worlds apart. And it took a lot of, let's say, grace to focus, to still be kind, to still be calm, to still put the patient and recovery first, despite the chaos on social media. So what I would just say is that it is quite far from reality, but I thank God that in everything turned out, if you ask me, well. Unlike what we heard or what we were expecting, but it took a lot of grace. It took a lot of absorbing so much that was just false. It took the fruit of the spirit, the whole 9 or 8 of them. I don't know. And the wisdom of God, kindness, sincerely. But thank God that it all ended well. Yeah. Thank you. Thanks.
What's the popular surgery for the male gender? Okay,
so sometimes they are quite big or overweight, and they also have love handles that show up in corporate shirts and uniform. So they want to remove that, or then due to weight, it seems as if they are having breasts. So they also want to remove or reduce that. Yeah.
What do you do to what are the secure measures you take professionally to make sure that You get your 97, that you're where you are right now at 97%.
You should be asking me all the things they made me do to make sure that we avoid anything.
Evidence.
Because I know of cases where people have severe heart enlargement, or people are diabetic, or people have underlying illnesses that could kill them if they do not tell the doctor. Tell your doctor all your history. Don't hide anything from your surgeon, so that they can prepare for everything, including your sporting. You will not even see dots on your body if you heal well. If you don't heal well, tell them on time so that they can prepare for, even if they can prepare for to avoid spotting on your skin. How much more your health and wellness on the table. People know that I don't joke with my ex, for me to submit myself to the body.
Understand. So
I'll do my research.
Evidence have
Thank you for that photo video bombing.
I didn't need to explain evidence.
Evidence.
So she's trying to say that we put her through a rigorous screening process with reviews, clearances from who needs to clear. Example, a cardiologist, sometimes a pulmonologist, sometimes a sugar doctor, that's endocrinology. Depends on what we are presented with. But everybody goes through adequate screening, blood tests, reviews, and clearances if necessary. And the entire team with our senior supervising consultant, everybody reviews and is aware of the patient, and then we take it from there.
So what are the professional care procedures that will have to happen now?
Alright, so as the time draws near, which is in a few minutes, the nurses will come in for her bath. So they'll help her to clean up, and should wear the gown, the designated gown, hair cover, all those things. Yeah.
So
They'll just help prepare her.
The bath, is it the usual bath?
Yes, but it's an antiseptic, just with more antiseptic to help her, to help reduce the load of bacteria on the skin.
Okay. I can see that you're making yourself at home.
Yes, please. I don't feel like I'm too.
Okay.
Give us the food. No, it's there. We clean at least 2 times a day.
Yeah.
And everyone picks up stains. I really do not like to see anything. So the nurses know, the cleaners know, the admin, everybody knows. We pick up stains and we keep sanitizing and cleaning. It's good for the patient, keeps them safe, secure from infections.
My name is Victoria Daniel. I'm a registered nurse here in Curvy Girl Essentials. Hello everyone, I'm Linda Sunday, a registered nurse at Curvy Girl Essentials. I care for the patient's body, soul and everything.
Hi, hello everyone. I'm Nurse Dockers. I'm the clinical nurse lead.
What are your major responsibilities here towards your clients? Like, how do you help them recover?
I ensure that their stay here are nice, no complaints, dressings are well done by my colleagues, and if any complaints of pains, we have pain meds to ensure that they are all stable.
Are you on call 24 hours?
No,
But you have nurses on call for 24 hours?
yes, each patient has a assistant nurse beside her.
This is 38 minutes before surgery time. How are you feeling?
Doing how I eat you through the food. So hungry.
So your doctor...
I feel so dehydrated too.
Yeah.
Can't drink water, can't eat. You might say something like doctor.
Recommendation before the surgery that you take how many hours?
Usually from 12 the night before. So normally I don't eat past 6. I have a great nutrition habit and lifestyle. And I also do intermittent fasting. Coupled with my fitness training,
And of course, I'm just so grateful to God that prior to now I already had an intentional lifestyle about longevity, about wellness, about fitness, and all of that. So this seemed like a walk in the park. But the thing is, mind is a very funny thing. This tricks on you. The moment you know that you're about to do something serious and you should not eat, that's when all your everything within you will just say, feed me. No, it's crazy. So I mentally prepared myself that I usually wouldn't eat till 12:1, but now I'm fine.
So the doctor said you couldn't eat for how many hours before the surgery?
From 12 midnight.
12 midnight. Okay, before the day of the surgery, right?
And in fact, 3 days prior, you should start eating light juices.
Do you know what you're going to be eating post-surgery?
Should have first give me water, ice, then juices, smoothies. The fat part, I'm not crazy about it, but the juices and smoothies, I look forward to that.
These are the preventive measures you want to take. Ensure you don't sit for 6 weeks so as you don't get any side first. And then to allow you to tell me for that period of 6 weeks. Wearing of compression garment is very important as to avoid swellings. Swellings last from 3 to 4 months. In between those places, we have itchiness, numbness, stiffness, and mood swings. So your mood can change at some point. You can be happy this minute, the next minute you're just all cranky and all. It's part of it. There also is insomnia attached to the surgery. Sometimes you find it difficult to sleep, which yes, it's not sometimes, it's normal. Your body is just trying so hard to adjust to so many things. So people see their period after the surgery. Hormonal changes. However, is worth it. That's okay.
So for me, that has worked now for November and December. As long as I keep wearing my compression garments, I can do work, right?
Yes, and pineapple juice should always be your best friend as long as you don't have ulcer. It helps with inflammations, it reduces the swellings. Take a lot of water. In a day, you should be able to consume 6 bottled waters of aquafina of any size. If it's a 1 liter of ever water, then you can do 5 liters a day. Yes, you constantly pee was to keep your kidney in check, so they can also help process the whole medications and also the whole healings.
Fruit therapy is good.
Yes, I'm hearing.
Is it only pineapple? So any fruit of any anti-inflammatory fruit.
Aside lemon and lime, you can take anything, smoothies, vegetables for blood supplement.
Spices, ginger.
Abstain from salt, less spicy food, because at that point you can't tell what appetite she's coming out with. She can come out with a whole appetite or less. So if she's someone that has less, fruits is advisable for her to always take, smoothies, healthy ones.
Yeah.
She also ensures she takes that. Sometimes she can do vegetable squeezed juice with no scenario of putting milk and all. Just the plain vegetables. That helps. It helps with the blood building and that. Beauty is pain.
This kind of beauty is
But it's worth it.
So can you break down what the morning makeover entails?
Okay, the morning makeover consists of you doing your breast lift, doing your arms. 360 repose, liposuction of the front and back. Then doing a BBL, then doing your thighs. So go as far as doing vaginoplasty.
All at the same time.
Yes. And
Jesus.
doing those things, you're accumulating so much pain for yourself because it makes your healing not too fast because you are trying to prevent the incisional line from the tummy top not to break out. You're also trying to ensure that the breasts don't go flat. You're also trying to ensure that your arms doesn't stress you too much. So many things you're having to, you can't, there's no way to support yourself very good. So you're just going through a whole lot of stress. Nigeria here, we believe that we have the right medication, that's payment for it. But however, it's also addictive. It's very addictive because it's difficult to pull out a client who is addicted to particular payments, because you're like, that is my all and all. I can't do without this. The memory has, the brain has programmed everything that my whole life depends on that medication. So without that medication, they can't live. And Nigeria here, we are really good, but from my honest opinion, I believe you should give it batch by batch. You can do the up act first, then the second one, the down second. By so doing, you've saved yourself pain. Yes, is money, but for me, I don't see the amount of money that will make my clients go through such pain. First, batch it out. That's the best I will
So
advise.
the batching, is it like every 6 months, every 1 year, every 8 months? What would you advise women, mothers?
Okay, to give yourself at least 1 year to ensure that you've recovered, your body texture is back to normal, so that they can actually transfer, see other fats. But mind us that some fats might not be, there will be no fats, much fat for you to transfer to your body. So you can choose to do the 360 BBL and breast lift first, and then come back later for arm, thigh, and vaginoplasty.
CS, according to some women, it's lazy, but it protected the vagina from expansion.
CS is among the best. It makes the child smart.
Can you imagine?
Yes, it gives the makes the child smart. During normal,
My children are geniuses.
during the normal pushing and all, because everything is down, the woman might not have the strength to push. And then
But that's why I'm so smart.
In the head, you can see whereby the child have a depression, that's a dent in their head. Sometimes due to pulling, the midwife or the nurse, doctor might break some parts and all. But just to see us go in there, get it out. And
No trauma
for the
child.
child. Nothing at all. Due to the stress the mother go through, the child might be unable to cry at birth. Immediately have to start massaging, tapping the baby for the baby to resuscitate, to cry and all.
But this is your opinion, right? It's not like it's a medical, but that's mad. Coming from a nurse, Jesus. No jokes here. I think vaginoplasty is something that hasn't really been talked about. The experience that a lot of women are suffering in their marriages, why some of the men step out, because for some women who don't know how to train their cervical walls through Kegel exercises before pregnancy, during pregnancy, and after, the vaginal walls and the muscles are weak. So after that mighty head passes through it, training needs to go back to the normal size. I think, can you define
Sometimes the
vaginoplasty?
men are contributing to it, because I see no reason why your wife just have a 6 months old baby and trying to get her pregnant again. The gender takes time to contract back. So if you don't give a woman at least a year to heal properly and then getting her pregnant again, it makes it difficult for the uterus to contract, to go back to normal, and then the vagina too. So it becomes slacky, because 6 months she's pregnant, 6 months she's pregnant. So there's no, the guys are actually contributing to it. No matter the exercise you're doing, if the spacing is not there, the child will actually, the vagina will
So
actually.
now, let it not be pregnancy. Just naturally wanting to have sex with your wife doesn't necessarily mean that you get her pregnant. Some women that do exclusive breastfeeding are able to not get pregnant on time. So it
works for some people.
It doesn't work for all.
At some point, I was opportunity to hear that. Okay, it was at an antenatal. Not pregnant women just discuss it. I breastfeed my child, I didn't get pregnant. I was doing the same thing. I got pregnant, I didn't know. So it worked for Mr. A, it didn't work for Mr. B.
Define the reason why vaginoplasty is done, so that women that
Alright, so you asked first about mommy makeovers. I would use this opportunity to say I have an issue with that term. I mean, mommy makeover trivializes it a lot. It makes it look like a walk and like it makes it look like some spa, you know. Those are major procedures, sincerely, because in a mommy makeover, you are most likely going to touch the belly, maybe doing a tummy tuck, lipo-abdominoplasty. You may do a BBL at the same time, and you may touch the breasts at the same time. If it's sometimes. So it's a combination of 2 to 4 procedures, sometimes 2 or 3 procedures at a time. So calling it a makeover trivializes how serious it is, but that's my personal opinion. So when people are doing mommy makeovers, they have to know that it is a major combination procedure. You're doing the breast, you're most likely going to do a tummy tuck, you may do BBL as well, or you may go down there to do a vaginoplasty, which is what you asked me. Now, medically speaking, a vaginoplasty creates or repairs the vagina. So if it's in a little baby girl that doesn't have the canal, a vaginoplasty will create one. But if it's in an adult woman who has had children
naturally,
yes, per vagina, a vaginoplasty repairs things, makes it tight again, makes it, you know, interesting again for the woman and her partner to enjoy relations.
are you giving me back?
No, that'll be after the surgery. That will before you can start bathing you. You know, then you'll be weak, so you can't bath yourself.
You know what I used to bath?
Yes. You have your super indicators.
Yes. That needs to be a brand. 2 babies have sorted. Now it's like I've had 5 children.
Who's like breasts? What will you not say about me?
No, you.
It's okay, alright, alright.
You can't be having this conversation.
So what she's wearing right now, you can't go close to her. She's sterile and you're sterile.
You don't understand.
That was a little bit too much.
You get that. Exactly.
Hi, sterile one.
Hey, I'm sterile.
Wow, again?
No, this one is just, we don't cover this because it's just for you to lay down. So how are you feeling so far? So good. What are you stressed out? So far? You're relaxed? Sure. Are you hungry?
Don't do
So
that.
say.
Don't ask me questions that you already know the answer for.
So sorry, I just want you to be so open about so you don't get the whole stress into
Yeah. Thank you for being such a sweetheart. That's not mommy.
I hate the word pimples. Pimples sound so offensive.
I think because the way, Jesus, guys, when myself and Dara went for United Nations because she was my plus one. I've never seen someone who spends like almost 3 hours just on facial routine. She's obsessed. Show them your face. Yeah, you're intimidating other people. Show them thy face.
My camera cannot flip.
So when she says something sounds like pimples, like I can understand that psychologically it traumatizes her. Just the thought of having a dot on the face. Sunburn now happened. We went to the field.
That was not sunburn. That was pimples from the streets. Do you know it was when we went to the last location? That's when nothing came up. My pores were closed. I was suffocating.
Sorry, my darling.
It's her fault. It's when I say her, I'm zooming in on the her right now. You want to know if she's pregnant?
Yeah, if she is, she's going home.
Do you think you're preggy? You're not sure?
I don't know anymore.
Oh wow.
I've stopped. We now do the natural. We check the date, safe periods, and pull out because what is this stress?
Have you had a case where somebody didn't know that she was pregnant.
You don't know? Yes. At this level, you now know. So you go know. We don't try to be, we don't switch content. Because some girls know that even during this procedure, we can get rid of the baby. But we're not going to help you do that.
Interesting.
You're afraid for me, Abby, my darling.
No.
I'm pregnant. I love you, baby. What?
Juju. No, just no.
Why? I'm clean. My God, it's good. I'm clean, yo.
Be done with it.
How many percent clean is she?
Your recovery is going to be smooth. Yeah, I can assure you.
He's a tyrant, though.
Like, you need some people like that sometimes, you know, to help you.
I think I like him already. Hey, we're about to begin.
It's getting real.
It's getting realer.
Oh, yeah.
What about the procedure?
Bye.
No, just
Okay.
Sleep, eat something.
All right.